Learn the clinical techniques to effectively manage and overcome anxiety and panic attacks. David D. Burns, When Panic Attacks, the new drug-free anxiety therapy that can change your life. We've all felt anxious at some point, but for many this anxiety doesn't simply go away. It becomes a persistent clinical concern, often leading to panic attacks. Imagine if you could take control of these overwhelming feelings and turn them into manageable challenges. What if the very thoughts and behaviors that fuel your anxiety could be transformed into opportunities for growth and resilience? By exploring the underlying causes and employing practical strategies, you can find lasting relief and achieve a more balanced, fulfilling life. In this, you'll discover how anxiety and depression are interconnected, learn to identify and change self-defeating beliefs, and harness the power of humor to combat negative thoughts. You'll also learn how to confront your fears through exposure therapy and uncover hidden emotions that contribute to your anxiety. These techniques will equip you with a comprehensive approach to overcoming anxiety and panic attacks, empowering you to take charge of your mental health and live a more fulfilling life. Ready to learn more? Let's start by looking at the relationship between depression and anxiety and the best ways to treat them. The interconnected nature of anxiety and depression. Ever wondered why anxiety and depression often seem to go hand in hand? The interconnected nature of anxiety and depression. These emotional challenges create a complex experience that can be hard to navigate. Anxiety is about the fear of future danger, like feeling panic while hiking on a high mountain trail if you're afraid of heights. Depression, on the other hand, feels like the catastrophe has already struck, leaving you feeling worthless and hopeless. There are 4 main theories about why anxiety and depression are connected. One theory suggests that people may just feel generally upset without distinguishing between different emotions. Another theory posits that depression can lead to anxiety because worries about feeling defective add more stress. Conversely, anxiety might lead to depression due to the wear and tear of chronic worry. Lastly, both conditions might share an underlying trigger, according to the common cause theory. Diagnostic labels like generalized anxiety disorder, GAD for short, help categorize these feelings for better treatment and research. However, these labels often rely on subjective criteria, such as worrying excessively for 6 months, which can pathologize normal emotions. Unlike clear medical conditions, emotional states don't fit neatly into diagnostic categories. Medications for anxiety and depression, especially those based on the chemical imbalance theory, have long been promoted. This theory attributes these conditions to serotonin imbalances, but lacks strong scientific evidence. In fact, many studies show that a significant portion of the improvement from antidepressants is due to the placebo effect. For instance, a study comparing Zoloft, St. John's wort, and a placebo found no significant difference in recovery rates. It seems these medications may have limited efficacy. Cognitive behavioral therapy, or CBT, is a more effective treatment for anxiety and depression. Research shows that CBT works better than medications in both the short and the long term. Techniques like keeping a daily mood log help track and change negative thoughts, providing a structured approach to improving mental health. Practical exercises, such as exposure therapy, are essential for confronting and overcoming fears. To manage anxiety and depression, consider using CBT techniques. Regularly monitor your mood with tools such as mood surveys and engage in written exercises to track and alter negative thought patterns. Avoid reliance on benzodiazepines due to their addictive nature and potential withdrawal effects, though combining CBT with medication can offer the best outcomes. Remember, genuine change requires consistent effort and practice. By focusing on cognitive and behavioral interventions, you can achieve lasting improvement in managing anxiety and depression, leading to a more fulfilling and balanced life. Let's take a closer look at some of these interventions. Uncovering and modifying self-defeating beliefs for better mental health. Uncovering and modifying self-defeating beliefs for better mental health. Ever wondered why you react so strongly to certain situations? The answer lies in understanding self-defeating beliefs, or SDBs, the underlying attitudes that shape your psychological vulnerabilities. By recognizing and changing them, you can lessen negative emotions and boost your well-being. Self-defeating beliefs fall into two categories: individual and interpersonal. Individual beliefs affect personal worth. Think of things like perfectionism, where self-esteem is tied to achievements or external approval. Interpersonal beliefs involve relationship expectations, such as thinking others must behave a certain way, or believing true happiness depends on being loved by someone else. It's important to distinguish between temporary negative thoughts and constant SDBs. Negative thoughts appear when you're upset, but SDBs are always present and fuel these fleeting thoughts. For example, if you have an achievement addiction, an SDB, you feel good while succeeding, but failure triggers negative thoughts, making you feel like a complete failure. This shows how SDBs underlie and intensify your reaction to specific events. To identify your SDBs, start with a negative thought and ask what it would mean if it were true. Keep probing until you uncover the underlying belief. For instance, someone anxious about an exam might reveal beliefs of perfectionism and approval addiction by examining their fear of failing. Once you've identified an SDB, you can modify it through a three-step process. First, do a cost-benefit analysis to list the advantages and disadvantages of the belief. This helps you see whether the belief is beneficial or harmful overall. Next, revise the belief by developing a new one that retains the benefits but eliminates the drawbacks. For example, instead of striving for perfection, aim for excellence while accepting mistakes as growth opportunities. Finally, test the revised belief by conducting experiments to see if it holds true. This could involve doing activities where you don't need to be perfect and observing your satisfaction levels. It can also be useful to confront your fears by exploring worst-case scenarios. For example, if you're anxious about public speaking, imagine the worst that could happen, such as forgetting your speech. By gradually facing these fears through exposure, like practicing speeches in front of a mirror or a small group, you can desensitize yourself to the anxiety. The worst-case scenario is often not as catastrophic as it seems, and this allows you to overcome anxiety and regain freedom. In summary, recognizing and modifying self-defeating beliefs involves understanding the beliefs behind your vulnerabilities, analyzing their costs and benefits, revising them constructively, and testing them in real-life situations. Using humor to overcome anxiety and negative thoughts. It's often said that laughter is the best medicine, but what if this were true for anxiety and negative thoughts? Humor can offer a fresh perspective on fears, transforming how you respond to stress and self-doubt. Let's take a look at 3 techniques which highlight this approach. Shame-attacking exercises, paradoxical magnification, and humorous imaging. Shame-attacking exercises tackle social anxiety by encouraging you to do something intentionally foolish in public. The aim is to discover that making a fool of yourself doesn't result in the disastrous outcomes you might fear. For instance, a psychologist once illustrated this by asking for teeny-weeny-sized condoms in a busy drugstore, creating an awkward but liberating moment. Similarly, a social faux pas, like asking to taste food from strangers' plates in a restaurant, may lead to a fun and eye-opening experience. People generally react positively to good-natured eccentricity, easing the fear of social embarrassment. Paradoxical magnification involves taking negative thoughts and exaggerating them to an absurd level. This helps you see the irrationality of your fears. Take the example of Mandy. Nervous about her Aikido test, Mandy practiced telling herself she would be the worst performer ever, imagining herself flailing clumsily while everyone laughed. This extreme scenario made her realize the absurdity of her fears, reducing her anxiety and allowing her to excel in the test. Humorous imaging involves replacing frightening mental pictures with funny, absurd ones. Jose, an ophthalmologist who feared going blind, could imagine himself as a celebrated blind doctor performing surgeries with a seeing-eye dog. This humorous fantasy helped lessen his anxiety. Another technique is to imagine your critical inner voices as cartoon characters, like Elmer Fudd, making them less intimidating and more amusing. To put these humor-based techniques into practice, start with shame-attacking exercises by doing harmless, context-appropriate actions that are a bit outrageous. The goal is to have fun without making others uncomfortable. For paradoxical magnification, spend a few minutes each day exaggerating your fears until they seem laughable. With humorous imaging, visualize your fears in a comical light or imagine your negative thoughts spoken by a silly character. Laughter can foster self-acceptance and highlight the absurdity in your fears. While these techniques might not work for everyone, they offer valuable tools for those struggling with social anxiety and self-doubt. By experimenting with these methods, you can find new ways to manage your thoughts and feelings, ultimately leading to greater emotional freedom and resilience. Confronting fear directly through exposure therapy. What if you could transform your greatest fears into sources of strength? Exposure therapy provides a revolutionary approach to treating anxiety by confronting fears directly. This method encourages you to face anxiety-provoking situations, allowing the fear to diminish naturally over time. Here's how it works. Classical exposure involves facing real-life situations that trigger anxiety. Start with the least frightening scenario and progress to more challenging ones. For example, a woman with a severe blood and needle phobia might begin by imagining having her blood drawn, then progress to watching blood draws, and finally have her own blood drawn without fainting. Flooding immerses you in your most feared situation until your anxiety subsides. For instance, someone afraid of heights might stand on top of a tall ladder. Initially, the fear would be intense, but over time, the anxiety would dissipate, and the experience could even become exhilarating. Response prevention is useful for compulsive behaviors involving resisting the urge to perform anxiety-relieving rituals. For example, someone with a compulsion to shout when parking their car can practice resisting this urge. Initially, anxiety will spike, but as they continue to resist, the anxiety will gradually decrease and eventually disappear, breaking the cycle of compulsion. Cognitive exposure addresses fears primarily in the mind and is effective for conditions like PTSD. Part of this is called cognitive flooding, which involves vividly imagining the worst-case scenario to desensitize yourself to the fear. For instance, a woman obsessed with the idea that her baby has been switched at birth might repeatedly visualize her worst fears until her anxiety lessens. Memory restricting combines cognitive flooding with changing the narrative of traumatic memories. For example, someone who fears public transportation due to a traumatic childhood incident on a bus might vividly imagine the event and then alter the memory by envisioning themselves as empowered and in control during the situation. This process helps reduce anxiety by transforming the emotional impact of the memory. To apply these techniques, start by creating a fear hierarchy, listing activities from least to most frightening. Gradually confront each fear, allowing the anxiety to build and then naturally subside. This process diminishes fear and builds confidence and resilience. By confronting the monsters in your mind, you achieve a sense of liberation and realize that the things you feared most were never as threatening as they seemed. Uncovering hidden emotions to relieve anxiety. Imagine if your anxiety were actually a clue to something deeper, a hidden emotion waiting to be uncovered. The hidden emotion technique offers a way to identify and address often overlooked emotional conflicts that manifest as anxiety or panic attacks. This approach involves recognizing and confronting repressed feelings that we might avoid due to fear of conflict or disappointment. Consider the case of Terry, who frequently experienced panic attacks at work and at home. These attacks seemed to strike whenever her boss was nearby or when she was alone. Despite appearing content, Terry secretly disliked her job, but felt pressured to maintain a good daughter image, which made her feel trapped and dissatisfied. She didn't want to disappoint her parents or seem irresponsible, so she kept her true feelings hidden. Once she acknowledged these suppressed feelings of rebellion and dissatisfaction and decided to pursue her lifelong dream of designing women's clothing, her panic attacks vanished. By facing and addressing her hidden emotions, Terry found relief and a new sense of purpose. The hidden emotion technique operates on the premise that anxiety often arises from unaddressed conflicts or feelings. People prone to anxiety are often very nice and avoid confrontation. They might harbor self-defeating beliefs such as the need to please others, fear of anger, and avoidance of conflict. These individuals push their true feelings aside, leading to anxiety. Take Marcy, a woman who had been plagued by chronic worrying for over 50 years. Marcy constantly worried about her son's safety, imagining catastrophic scenarios, and about her husband's health. This incessant worrying masked her unexpressed anger and frustration toward her sons and husband. She felt annoyed with her sons for their life choices and harbored resentment toward her husband for various reasons, but she suppressed these feelings to avoid conflict. Once Marcy identified these hidden feelings and communicated them openly, her anxiety dissipated, leading to better relationships and a significant reduction in her worrying. To apply the hidden emotion technique, start by reflecting on recent events or relationships that might be causing subconscious stress. Be honest about any negative feelings or desires you might be avoiding. Communicate these feelings constructively and take action to resolve any conflicts. Recognize that anxiety can be a signal from your body indicating a deeper unresolved issue. By identifying and addressing these hidden emotions, you can achieve significant relief and a better understanding of your emotional health. Understanding and addressing your hidden emotions can lead to a more fulfilling and anxiety-free life. In this summary for When Panic Attacks by David D. Burns, you've learned that understanding and addressing the root causes of anxiety can lead to significant relief and improved mental health. By identifying self-defeating beliefs, employing humor to combat negative thoughts, confronting fears through exposure therapy, and uncovering hidden emotions, you can transform how you respond to stress and anxiety. These strategies provide a comprehensive approach to overcoming anxiety and panic attacks, empowering you to take control of your mental well-being and live a more fulfilling life. Okay, that's it for this summary. We hope you enjoyed it.